Welcome to the SABINA Lifting Overview. SABINA is a variable geometry sit-to-stand lift especially designed for patients who are able to actively participate in the standing exercise. There are two models of SABINA, the SABINA and the SABINA Comfort, and they are very similar. The SABINA Comfort, however, offers a wider sling bar and a comfort vest for greater support across the back with less underarm pressure, making it particularly suited for those who are frail or partially paralyzed. In this overview, we will demonstrate some of the most common lifts using the support vest, the total vest, and the comfort vest. To a limited extent, SABINA may also be used with certain models of LIKO slings to transfer patients who require a total lift. Please note, it is very important to select the proper sling bar, and accessories for each lifting application. Please refer to the instruction guide for more detail. And if you have any questions, please consult your local distributor or LIKO specialist. In order to be brief, we will frequently refer to procedures that have already been shown. In most cases, returning a patient to a seated position from the lift is simply a reversal of the lifting procedure. The LIKO support vest is a comfortable, general-purpose sit-to-stand vest that is easy to use and requires little individual adjustment. Designed for use with a narrow sling bar, it lifts around the back and under the arms. Equipped with a waist belt to keep the vest in place, the inside is lined with corduroy to prevent the vest from sliding up. A bolster liner of synthetic sheepskin can be added to provide a softer surface. To lift a patient from a wheelchair to the toilet, slide the support vest waist belt down behind the patient to waist level. The patient's arms should remain outside the vest and the waist belt. Fasten the plastic buckle on the waist belt. Then comfortably adjust the waist belt to the girth of the patient's torso. In general, lifting with SABINA is easier if the patient sits with the hip joints at the same level or higher level than the knees. Position the SABINA lift and then adjust the width of the base so that the patient's feet can be centered on the footrest. The lower legs should be parallel to the lower leg pad on the lift. Adjust the horizontal and vertical position of the pad for comfortable resistance just below the kneecaps. Attach and tighten the strap around the lower legs. The vest is equipped with two straps, outer and inner, for use depending upon the girth or the height of the patient. Generally, you should use the inner strap to achieve a maximum upright position. Attach the vest straps to the sling bar. Please note, to compensate for weak muscles in the lower body, we recommend that patients lean back with their upper body. This enhances comfort and prevents the vest from sliding upward. Operate the SABINA lift by pressing the buttons on the hand control. During the lift, the patient can participate by grasping the sling bar without pulling themselves forward. During raising, the upper body tends to become narrower, causing the waist belt to slacken around the upper body. This is a natural tendency and does not affect raising in any way. Please note, do not tighten the waist belt around the patient in an upright position. The waist belt is only intended to hold the vest in place, not to lift or secure the patient in the vest. Transfer the patient to the toilet, lowering the lift arm to achieve a seated position. The waist belt should not create excessive pressure on the patient when in a seated position. When lifting from the side of a bed to a chair, the same basic procedure is followed. Slide the support vest waist belt down behind the patient to waist level. The patient's arms should remain outside the vest and the waist belt. Position the SABINA and adjust the lift as needed, including the lower leg strap. Attach the vest straps to the sling bar, then lift the patient using the hand control. Transfer the patient to the chair, lowering the lift arm to achieve a seated position. In addition to the lifts that have been shown, the support vest can also be used for transfers to bathtubs and other lifting applications. Please note, in some cases, a seat strap and sling bar accessory may be helpful to assist in SABINA lifting situations. Please refer to the instruction guide for more detail. The LIKO Total Vest is another patented sit-to-stand vest that is unique in safety, form, and function. Particularly helpful for patients who may suddenly collapse during a lift, Total Vest utilizes a cinch belt that continues to hold around the waist throughout the procedure. Similar to the support vest, it is designed for use with a narrow sling bar and offers a bolster liner of synthetic sheepskin for a softer surface. Slide the Total Vest waist belt down behind the patient to waist level. The patient's arms should remain outside the vest and the waist belt. Cross the loop straps and thread them through the D-rings on the opposite sides. Pull on the straps to check the tension. If the waist belt does not tighten sufficiently, change the threading of the loop straps. Please refer to the instruction guide for different fitting alternatives. Determine which of the loops should be hooked to the SABINA by pulling on the inner vest straps and the loop straps simultaneously. Equal tension on the vest straps and the loop straps provides optimal fit during the lift. Position SABINA and adjust the lift as needed, as shown previously. Attach and tighten the strap around the lower legs. Attach the previously determined loop straps, then vest straps to the sling bar, and proceed with the lift. To lift an alert patient from an automobile, they must be able to pivot on the seat and place their feet outside the car. Only lift until the patient's weight is removed from the car seat. Taking care to protect the patient's head, pull the SABINA away from the car. Once clear of the car, complete the lift. The LIKO Comfort Vest is the recommended vest for the SABINA Comfort Lift. As previously mentioned, the Comfort Vest offers greater support across the back with less underarm pressure, making it particularly suited for those who are frail or partially paralyzed. For the Comfort Vest, the patient's arms should remain inside the vest and outside the waist belt. Adjustment and connections are the same as for the Total Vest. In conclusion, it is very important to select the proper sling bar, and accessories for each lifting application. Taking the time to remember these simple procedures will pay off in years of safe and comfortable lifting for you and those you care for.